We have a fun panel coming up now with sales and marketing, which this panel, I never thought, while I was here at Clemson, I would ever be moderating or a part of a sales and marketing panel. Since I graduated with engineering, I was just like always focused science, engineering, and all of that. But the more and more you look at sales and marketing, just in a broad sense, is it fits into everyone's life. Whether you're marketing yourself to get a new job, whether you're networking and just trying to sell what you're, interested in, whether that your job is sales and marketing or engineering or science, biology, it really intertwines within your life in ways that you might not even expect. So I'm really excited to introduce our panelist. And I want to start with each one of them going through their just specific personal journeys. We have some really cool stories up here. Amanda?
Oh, my personal journey. So I told you a little bit about my current company, Pole Manage, but my second company is called Carolina Diagnostic Solutions, and I fell into that just almost out of need. I left the bedside, started my first company in basically contracting services to pediatric offices, but I needed equipment, and so was reconnected with an old colleague that I had worked with at Arkansas Children's that was selling equipment. Long story short, he calls me about 6 months later. He goes, "Hey, would you do me a solid?" And I was like, "Sure. What do you need?" He said, I've got this business in the Carolinas, and you know this equipment inside and out. Could you just manage these accounts for me? And I'll pay commission, whatever. And I said, "Sure." And then he comes back to me about 6 months later. He says, "It's really stupid for me to write you commission checks because I'm holding a piece of the pie and you've done all the work. Why don't you, and you know all these customers anyway, why don't you just buy the Carolina business from me?" So that was how I became a distributor. I've got 3 international brands that we distribute respiratory diagnostic devices for. Clinically, I've used all of these devices, almost everything on the market. So it's very easy to talk about the pluses and minuses when you get into features and benefits and clinical use and efficacy and payments and all the things. And then from that, I formed Pole Manage, but Pole Manage was really part of my vision and what I needed when I was back managing pediatric asthma across the state of South Carolina. And I only saw those patients at most 1 to 2 times a year, but I had to make treatment plans and therapeutic recommendations to their providers. And so that, I guess, that kind of sums up most of my journey, and I'll save the rest for later.
Awesome. Afternoon, everyone. Brian Chester, class of 97. I was able to walk on the basketball team here. So the Rick Barnes years, and as we were talking about last night, I was there for the Dean Smith fight, for anybody knows the history there. But yeah, I graduated with a sports marketing degree. So naturally, I'm at the Life Sciences Symposium talking about sales and marketing. But I initially began my career in sports publishing with ESPN the magazine and Golf Digest magazine, and it wasn't enough for me personally. And when the jump to med device and life sciences, it was more of I wanted to give back, and I wanted to be able to. I always had a sense of community with my family and the church, and there was a way to do both. And I was always wanting to be customer facing. So med device sales was a great avenue. So I was lucky enough to start with Synthes Orthopedic Trauma, and now is DePuy Synthes, owned by J&J. So carried the pager, did the orthopedic sales for a number of years, moved on to Stryker Biotech, selling a bone morphogenetic protein in spinal fusion. Carried the bag there, achieved quota, was great. But the most important piece to me personally was being able to be a resource to physicians who are able to treat patients. And that was a big deal to me. And it felt less like having to hit numbers to me. It was more, I just wanted to never let them down. And so the more I was able to do that successfully, the more they depended on me. And in med device sales, the more they depend on you, the more you get called. And so that was ultimately, it was a win-win in my mind. after a while, if you're in med device sales and you achieve success, you're training new folks, and there comes that itch where there's something more you need for yourself. And for me, it was in the form of a startup. So I was recruited to Sonendo. It was a very, very sexy device, is to treat root canals. What was attractive to me was the ability to build a program, to build it from nothing, to build it from concept, with the goal to go public. But what was attractive was, I don't know, maybe by show of hands, does anyone know how many root canals are done per year in the US? 15 to 17 million. Root canals get sexier when you're in sales. You know what I'm saying? So that it gets real attractive. So was with Sonendo for 8 years, became the vice president of sales and professional education, was able to build a program there, and then now currently senior sales director with Henry Schein, where they're brought me on to build a business unit within the endodontics division within Henry Schein. So super happy to be here. Thank you.
Hi, I'm Margaret Lynch, graduated in '86 in nursing, got my BSN here at Clemson, and just want to thank y'all again for this opportunity. I'm just humbled by all the talent that's here and all that I've learned today. But started my journey at Clemson and really learned a lot from Clemson, was able to get into some leadership roles with the president of Student Nurses Association, co-chaired Speakers Bureau, student government, learned a lot from that and a lot about bringing people in like your Bruce Jenners and whatnot and picking up at the airport. And then also was chaplain at Kappa. So a lot of leadership that led into my sales career after nursing. But grasped the nursing, loved it, had a wonderful nurse instructor here in pediatrics, Dr. Sherry Thompson, and fell in love with the role in pediatrics and realized I really wanted to do just about everything I could in pediatrics to learn. So I did everything from NICU to PICU to burn, working with the first children or baby with AIDS, Trevor in Charleston, that I took care of years ago before heart therapy. And that'll date me a little bit. I was in oncology before Zopran, which truly dates me. But I thoroughly love my nursing career. I realized that through my nursing career, I would get very attached to my patients and my families. So I decided that I was encouraged to do traveling nursing. So I was told that if you combine your passion of what you love to do in life, which I love to travel, with a job, a lot of times a job won't seem like a job, and especially if you love what you do. So took off across the country, all around the country, and met some of the most amazing friends. As I still have some of the most amazing friends from Clemson and Tailgate next to my roommate and her husband from home. But as I went on that journey with traveling, I also realized I was still attached. I was out of the politics of the hospital. So when I decided to stay in Denver, got shifted back to night nurse. I love the hiking and everything you can do in Colorado. So somebody sent me their blue suit. I bought Interviewing for Dummies because the internet was not what it was now, where you could Google jobs and that kind of thing. And off I went and interviewed and had the opportunity to go on with that company in medical equipment and absolutely loved it. So was one of few women in the 90s in medical equipment, and boy, did I love it and respected the VP who took a sales on me without having any sales experience, and took Dale Carnegie 101 to further my understanding of sales and learned from some of the best who called on us in the clinics and around, some of the best reps out there. So I could appreciate what I saw in the people and how they delivered and what their focus was to learn, from good sales. But I missed the passion of oncology. I truly wanted to make a difference with the patients. I wanted to focus in. And so once we moved to Midwest, in sales, I actually was covering a lot of the West. And as I told this group last night, I fell in love with El Paso. Flew in on a dirt storm. So you don't, if people say, I'd really like for you to cover this city, don't get caught up in what you think it is. Visit it, and then you might fall in love with it like I did. So covering most of the West, moved to the Midwest, and I was able to join another company in oncology and another VP of Sales took a chance on me without that experience. And it just bombarded from there. I got to go with startups along the way, the innovative sciences, the new product to market, the excitement for the patients, the potential for cure. My first drug was IL-2 and an immunotherapy that was, had a lot of promise back in the early 2000s. So just to be a part of that, I was just humbled by it all. And I never lost my focus for the patient. And as my journey goes on, I've covered just about everything you can do on this side of sales and what I was looking to do, from mentoring to training to the marketing with the fab teams. And I have realized that I've been very blessed. So I just want to be a voice out there for anybody who along the way is in a career, not real sure what their end goal is, to know that we want to keep the best nurses in nursing. I don't want to take any way away, and this is one of the best programs in the world. But there are other opportunities if you feel a burnout and that along the way. So we'll continue on with that.
I love.
I'm sorry, I tried to keep it short, 40 years.
Well, I'm actually going to throw another question at you because I want to dive a little deeper too, because I think it's so inspiring and just an awe of your story of starting in the clinic, being a nurse, also you too, Amanda, right? Being in the clinic, seeing the patients, and then transitioning to sales. How did you even think about doing that? What were the challenges around kind of that transition period?
So that is a great question. I think the challenges back then, I'm gonna sound like my mom, there's the internet. Now, so you can look up so much and have that. I would go to the library and look up things too, and read the papers but it was coming around. But I think I was excited for the opportunity, especially that somebody was taking a chance on me. I was actually just kind of interviewing who knew if I would get the job. But my team, I look back at my team back then who was so supportive and took again, the Dale Carnegie 101 sales took when you work with the speakers group, so you can learn to speak in front of people. I still don't feel like I've mastered that at all, but I just feel like finding your way through mentorships, even back then, I think they're better today in pharma and for, everybody. But just really focusing in on the patients to make a difference, and that's what I wanted to do. So I think that's what led me back to oncology.
Anything to add to that, Amanda?
Yeah, I think so. I went into sales not because I wanted to be in sales, but mostly to do a solid for a good friend. What I found is that I worked in university academic labs prior and managed the people and the equipment and the vendors, all the things. So I was very comfortable going in and talking to the end users. But I will tell you that outpatient care is very different outside of a large health system, outside of academic centers. When you go and call on private physician practices, I'm telling you, it's the Wild West. And there was some crazy things. I was incredibly appalled at what I was seeing that was happening in these offices with regards to diagnostic testing, lung function testing. There's a standard, an international standard that should be met. We had quality control issues that would not stop. I've since for years, sat on panels in my professional organizations and special committees trying to help right some of these wrongs that I encountered. But I think that without having that experience and being able to go in and see that firsthand, because I was just following kind of the money and where I needed to be at that point in my career, I think that it really became more to me, not just selling. I'm not here to just sell you a device or a widget because anyone can do that. I want to make sure that you're using it correctly. Do you have solid training? Do you have good clinical expertise? If not, I'm happy to come alongside you and provide that for you. I just want to know what's being done for these patients is what's right.
Great points. Great points. And Brian, I know your journey was more of I would say traditional, right? Going into sales from business, from school. And I know we do have a couple of business majors in the audience right now. How can they stand out to be able to be a sales rep in the clinic or life science world when they're a business major and maybe they don't feel confident to know the science behind it all?
Yeah, I think Chris touched on it during his session. I think number one, just be yourself. Understand where you are in your journey and be humble. That's the word I was thinking about with you, Chris. It's like you can be as confident in yourself as there's a difference between confidence and arrogance. You can be confident in what you know you're going to bring to a company, but humble enough to know there's a lot to learn. Humble enough to know that if I'm going to be in the operating room, I have my role, and humble enough to know that I'm just turned 50 this year, and every time I speak to a doctor, I'm asking them questions all the time. I'm asking my CEO questions. Can I be a part of that board meeting? I just want to sit in the back. I just want to learn. If you have that about you, but you're confident in yourself to know where you are, this is a unique world where you don't have to know the answers. You just have to be ready to go find them for the customer, for the doctor, so that the patient gets everything the patient needs. So when I'm interviewing, whether it's for a role that I'm currently interviewing for now, where some experience is required, when I've interviewed folks out of college, I wanted to know three things. I wanted to know, and there are ways to prove it. I'll tell you in a second. Do you work your butt off? By the way, every interview, every single person I speak to is the hardest working person I've ever met in my life. Do you know your product? Like whatever you've done in your, whether it's here at Clemson, whatever you're going to showcase with me, did you know your stuff? And the third one, can you create relationships quickly? Do I like you? Like at the end of the day, if I have two resumes, I mean, who do I want to work with? Because that person is going to be the same person that the doctor wants to work with, or my other teammates want to work with. So if you have those three things with a little bit of humility, just it's going to be fine. And if it's not fine, it's not the right fit for you, right? It's just not right for you, because every interview is a two-way street. Although we're looking for the right candidate for our team, you should be looking at us if we're the right fit for you. And I know everybody wants a job, like, oh, I just want to get this job. But if the person's just a jerk, and I've interviewed with a few of them, and I'm like, well, that's unfortunate, because I thought I liked that company, but this guy just I don't get along with him. That's okay. But just if you're humble enough, because I learned from one of my mentors, and I'll stop here in a second, but he's always said to me, made me laugh. He said, God made work so adults can play together. And maybe, and if you knew Bob, you'd be like, yep, it's a Bob thing. But it's so true. Like teams function really well when they do it for one another. They do it for the patient, and the money, the advancement, all the things, it follows. But sales is a very humbling role, although it sounds like, oh, this guy's got buttoned up, or she's just so strong, and she's the, no, we're all wanting to learn more to make us more dependable for the customer. There's always that element of that. And when you lose that, that's when things go wrong.
Awesome. Yes, relationships are key no matter what part of life you're in, right? Sales, marketing, jobs, even just meeting someone on the street. You never know who you're going to run back into, who you might be working with in the future. So relationships are powerful. One thing that I actually have been kind of working on and improving on is storytelling. Storytelling is a big word, and you're like, what? How do I even start doing that? What do I even use in my toolbox? But to really, in my mind, for a great sales, great marketing, just really to improve the relationship and the connection, that storytelling is key. Tell me a little bit about how you guys learned how to, tell a story and be able to engage into, really connecting with your customer.
I think so. I sell directly to physicians, primarily, or other clinicians. So being able to hit on a collegial level is very important. It sets me aside from all the other sales folks that are coming in, because I understand, like, I've been in your shoes. I've had to do what you're doing. There's a little more, it's a little easier, I think, in some ways, but you're right. My first company, again, single shingle, trying to understand how do you get the message out. And so I found this company based out of, I think, Nashville, Tennessee, called Story Brand. And they podcast, they have YouTube, all kinds of things. But really, the framework for this for their platform teaches you how to put together your story. How do you build the brand story of what you're selling, what you're building, and then as I've followed this for many years and read many of the books produced out of this company. It also helps to frame out what I'm doing in Pole Manage. What's the story? What's the core of the company? What's our mission? What's our mission? What's our vision? And can I clearly communicate that to my team? Can I communicate that to my investors? And I think regardless of what you do, you have to understand, one, you have to own your own story. And it took me a long time to be comfortable in my own skin. I think that's part of just getting older, which is I'm very grateful for. Other than like my knees not feeling so great, I'm not excited about that part of aging. But I think just understanding how to articulate who you are and being comfortable to know that you may not look like everyone else and you may not sound like everyone else, but that's okay. At the end of the day, your story needs to communicate very clearly who you are, what you do, what your value proposition is, how are you going to solve the problem for your customer.
Well, I agree with Amanda. Really, she hit the nail on all that as far as storytelling. I think in pharma, your storytelling has to really respect the scientific integrity and also the pharma guidelines that come with it too. So you incorporate that, and your storytelling can change and grow as time goes on, because we're all changing and growing. We have different questions, different things happen with the patients. The new drug might have a side effect that came out that wasn't in the trial. So just understanding and making your story personal, I think, is very important with your customers. I've watched a lot of my KOLs grow up, which is really fun and really neat to look back. So some of the KOLs that I call on, I knew them when they were residents or fellows. And to see them grow up and become these thought leaders and work together with clinical trials and research, bringing my medical side in, the storytelling gets amazing because they have more stories to tell to add to what I want to bring to them. But it's really all comes down to focusing on the patient and their needs. And then in sales, it's fun. And you keep that focus, and then the numbers will come with that. The successes will come, and not to worry about that. But it's an exciting world, I'll say. Oh, in relationships, I totally agree with that. I ended up following a VP and a manager to a startup company, which was wonderful. Ended up having my amazing twin boys late in life along the way. So I ended up taking some time off, and the VP I left was the next one to hire me. So I didn't burn any bridges. Then I went back to this man and just was very humbled by him accepting. So not burning those bridges, as Woody and others have said, is a great thing. And keeping those relationships going, because you really don't know where they will lead to.
Okay,
I was thinking
just
that-
real fast. We hear the word story in this world of life science and med device. When you're dealing with doctors, it's not. It's nonfiction. Like, this is a story. Like, we're talking about reality, but I think the better stories have the why in there, right? So just know your why. So early on, when you're learning the craft, when you're learning with the job, find your trusted advisors. I would find doctors and just sit in there and say, hey, can I just learn from you? They're saying I'm supposed to say this, or they're telling us this about this. What are your thoughts on that? And they'll tell you their thoughts. But just if you find your resources to understand what's important to whoever you're speaking with, but understanding the why behind why do we have to tell the story? What is our story, but the why behind it? That if you hang on that, no matter where the conversation goes, you can go right back to that.
Great points. Great points. So we all have something in common, right? We're all entrepreneurs. We all like to start companies, build companies, grow companies. A lot of times, starting the company and the smaller companies, they don't have a lot of funding or money to have these big sales teams, marketing teams. So I'd like to dive a little bit deeper into what are some innovations or some technologies that maybe a startup company that's being formed or even a student that's in the audience thinking about, I may be working for a startup company one day, but they don't have a lot of budget for a sales and marketing team. What are some technologies, innovation, AI, any kind of tools that you guys have been using recently that might help out with, improving and advancing, saving time on any of the sales and marketing tasks that you guys have been doing lately?
It's in my world, it's in sales, it it advances, but it doesn't necessarily change. I mean, eventually we have to be in front of people, but I think the one thing that COVID gave us was everyone's acceptance of Zoom, Teams, virtual calling. So having the ability to create focus groups and getting a lot of people on a call to brainstorm and do, like, we're very creative now with Teams or whatever your company subscribes to, but doctors and our customers are also aware and comfortable with this, whereas in the past they weren't. So for us, gaining their time is a lot easier now. I mean, it's not perfect, but for us, and just brutally honest, like, if a startup, it's a product that we just need feedback on right away. We can get feedback almost within a day, whereas in the past it was a lot more of an effort. So as far as AI tools with sales, I mean, I live on audiobooks. Like, we have a lot of windshield time or air travel time. I think I subscribe to Chris Voss, Never Split the Difference, The Art of Negotiating. It's not necessarily a sales, but I promise you it'll change your life with how you communicate with your loved ones. It's
Good
changed.
one. The negotiating one?
It is changed.
Everyone should hear.
You should absolutely get it. It's changed how I communicate with my kids. I never thought mirroring would get my son to speak to me more. Like, how's your day? Good. And I'll be like, good, huh? And he'll be like, yeah, the stupid math. I was like, oh my God, he's talking. So, like, those kinds of things, like, never stop those kinds of things with sales, but I'll pass it on with the AI things. But for sales, it's more been the virtual meetings. For us, it's been huge.
Yeah, so virtual meetings are a blessing and a curse, because you can be booked, and if someone has control of your schedule, and you can be booked back to back to back to back, and it is a blessing, but it's also very frustrating. So I use an AI note taker. I think someone talked about that this morning, and everyone doesn't love that, but if you come to a meeting and I use my AI note taker, I will freely give you you can have a copy of the transcript and all the things, because I want you to benefit from being able to review that conversation. Maybe we talked about specifics that are going, maybe I talked with my legal counsel and we talked about specifics going into a term sheet, or an issue that we really needed to hone in on. And I was, back to back to back, and all kinds of distractions happen. So you can go back and review that. So I use that as a tool, but I also use Google is your friend. It's a blessing and a curse as well. So on the distribution side, we've done quite a bit of digital ads and used videos and LinkedIn, and I think all the things that are pretty common to most people in this room. At the end of the day, I think Brian's right. You just have to have a relationship and a communication, a connection with another human being. And if you can use one of those tools to achieve that, then it was well worth its weight.
I agree, being the third one to talk about it. My wonderful husband loves AI, so he keeps me abreast of the newness in AI, as well as my sons. I'm adopting it. Again, I'm not going back to age or when I graduated, but I am loving that it is here to stay and it's changing the world. And just some of the earlier talks about how it's being incorporated into their startups, and Their discoveries is absolutely amazing. LinkedIn is my go-to to keep up with new. It definitely has algorithms, so it knows what disease states I focus in on and what groups I call on. So I can kind of get a quick synopsis from the day with that. And then the Zooms, I guess over COVID, I was very thankful for it. But today, I can't say shoot me. I'd rather be in front of the customer any day. But if it can save them time in place of that, but I am so much more about in-person, meetings. I don't think I'm the best Zoomer, but all good.
Great tips there. I do want to open it up for questions, but one last kind of just easy slam dunk, right? For basketball days.
You see how tall I am? I didn't dunk very much.
You did score. What first point? What was your
Oh yeah, my fun fact.
fun fact?
Thank-
Yes.
I was the first walk-on at Clemson to ever score a point in NCAA tournament.
Yeah.
I can,
Uh,
and we won by 23 instead of 21.
okay, before we open it up to the audience, one last kind of tip or advice for the students specifically in the audience on how they might even find themselves that they might like sales and marketing as a career.
I'm third, now I'm first, thank you. Gosh, well, let's see. I would say I get asked this a lot in the field, and a lot of people would ask me, would I do my nursing again? And boy, would I. I didn't leave nursing because I really wanted to. I just felt like I could serve my patients better in the role that I am now. But I feel like, have your resume together, ready, updated. It is the first impression of who you are out there. And get excited because the opportunity is real out there. There are so many people hiring and so much innovation going on in health sciences. There's more opportunity than ever was before. If you looked on LinkedIn, I always see, and so I'm happy to say I started this job. I never heard of these companies for the most part, and I felt like I was keeping up. But working with recruiters can be really key. I work with some phenomenal recruiters. And since I've been with this last company a while, a lot of them have given up on me, but I still get those calls monthly. But they will keep you up on the know with the new, what's going on, whether it's CAR T, targeted therapy. They know what you're excited about and where your focus is. To get that confidence from your inner self and to know that your uniqueness is exceptional and it can play a great part of where you go. And people, when you look at the culture, a lot of times your manager is the one you're interviewing with, and you're going to be your first step into a company. And to know that that could be part of your culture, right? That's who you're going to report to. And I agree with what you said. If that doesn't click, there are so many other opportunities that can come your way. And so just to not give up, lean on your faith. That has gotten me through life, ups, valleys, and peaks. And just to know that the opportunity will come, but just to believe in the hope for your future and the changes that if you end up in a degree and you're like, well, what did I do? Keep going, research, take classes online, listen to podcasts, and go back to school. There's so many opportunities that you can do. And age is just a number. I could still go back to school, but I'm probably not. But I think that for everybody out there, there's so much opportunity.
While you're here, one of the best pieces of Clemson is there's so much to offer. There's so many clubs, organizations. Get involved in, I don't care if it's pickleball. My son just told me that this morning, Dad, I'm doing the pickleball club. Like, just do it. Get to know people, network yourself, and anyone you meet at Clemson, whether faculty or in the athletic department, wherever you are, be there, like wholeheartedly to learn more, because the story you tell for whatever work you're looking to do, they want to hear your story, right? So if there's nothing on your extracurricular activities, if there's nothing there, it's okay. But I know full well what Clemson offers, and it's far more than I've ever, like when I was here. But get involved. It doesn't matter what it is. Get involved, tell your story. And the other piece I would say is just take a deep breath. You are enough, right? You are in front of the hiring manager for a reason. We get your resume, and that's the first time. You don't even get a chance to be a part of that. I'll look at that, and I'm like, yep or no. So if you're in front of the manager, you've already made it past step one. So take a deep breath. There's a reason why they want to speak to you. Okay. And it's those three things though. And the one thing, know your resume. Don't look down and say, oh yeah, what did I put for that? Please don't ever say that. Just know your story, like know what you're doing. And the last thing, and I just passed on this this candidate in Boston, 25 years in the industry, and he shows up for a Zoom interview. He had a golf shirt on, was a little wrinkly, and I'm the second I saw him, I was like, you can't put on a coat and a shirt. I don't care if you have gym shorts underneath. I'm only seeing up here. Like, show up, right? If you get a Teams interview, that's okay. That's how the world is today. It's not because they don't like you as much. It's just, hey, I want to get this done now. Get yourself dressed. Get yourself ready as if you're in person, because you are in person. So give your best self to that interview, but just know deep down, be confident in who you are, because you are enough for whatever role you're interviewing for. Just tell your story right and just be yourself. Can't say that enough.
That's great advice. I think I kind of piggyback a little bit on that and say that everyone is in sales, regardless of your position in the company. You represent the brand that you work for. And so please show up and represent well, but you also represent yourself. And so you're constantly selling yourself throughout your career, regardless of what logo you're wearing and who you work for. You're selling yourself. What is my ability? And really, sales is easy. Sales is just the ability to have a conversation with another human being. That's it. And you build on your sales. Good sales are built by relationship. Because it doesn't matter what widget we have, you're going to buy from the person that you trust. And in the respiratory world, it's a pretty small community, and we have people that hop from different companies to different companies. But for the most part, generally, if you've been around for any length of time, you're very well known. And so your reputation will follow you regardless of what logo you're wearing. So I would say, be sure that you sell yourself first. Integrity is key, and I think just being able to tell your story is very important.
Usually people hear me anyway. To the students, what they do, I'm telling you, this is so hard. So they're talking about all this stuff very fluently. It's hard. Brian, I know you can close anywhere, and you guys are closers. But I've observed, it's a clinician question to the nurses. I have observed hiring nurses or some doctors in a sales capacity, and of course they know the science, they know the applications and so nail it, but they really struggle to close because they kind of get lost into just being their friend and talking about the product. But at some point, you got to look at a doctor and go, this is the last trial piece I'm giving you, right? You got to buy it, and that's hard. And I've seen that conversion fail quite a bit, but clearly you guys have done it. So any advice for us?
I think that when you talk to your colleagues, you talk to them like they've already bought it. So you start to close from the beginning that you start making your presentation. And it's the language, just like you talked about the whole mirroring that concept to get someone to talk back to you. It's the same concept. You've already bought this. So when we go to implementation looks like this for you, and you walk them through that, and you typically have much less resistance and pushback. You don't have to go through the layers of fat to be able to get to the complete close. You have to get all the stakeholders to basically, shake their head and check the box and all the things. But if you have a clinical champion, you can usually get to that much faster, and there's much less resistance to happen.
That's a great question, I think, too, because I think I learned from so many of the reps coming in that called on where I was working as a nurse, which helped me a lot. But I think also that relationship and that consultative collaboration or collaborative call can make a difference in any aggressive call. And if they remind them to make it personal, so if they have somebody with cancer, when they want to see, that family member get this drug, what will it take, in order, in your conversations for the HCP, the healthcare provider you're calling on, make it personal with them. I think they'll make it personal with you, but if you make it personal with them, then it can be as easy at the end of the story as saying, does that make sense? And then, asking the questions. So if you keep it simple with the close, instead of getting so caught up in the verbiage of what could be a great close, I think it can come with time and experience, but just the excitement and the desire to make a difference that day, it might start coming easier to make it personal.
Thank you.
So sales is a pretty competitive field. How do you guys handle competition?
I love competition. I feel like if I'm the only one speaking about a product category, it's not important enough. So if there are other products out there to speak about root canals, and whatever it is, it could be orthopedics, it could be root canals, it could be these chairs. The more competition, the better. This is where selection of companies is where you want to, if you're in a pretty competitive space, like in the OR, you obviously want to work for a company that provides a product that you feel good about and that doctors respect. And you can kind of lean on that respect there, but competition is great because all that means is they're talking about you without you having to talk about it. I've always educated our team, and I say that nicely, because sometimes we've spent more meetings with some of my earlier reps with all they're doing is talking about competition. Like, this product does this product does that, this product does this, and ours does that. You've spent more time talking about them than you did talking about what our product does. And you've completely lost the fact that the individual, the one who you're calling to depend on, the relationship, the we part of it, you've lost that. You've made it about a transaction, a commodity. And the piece that you want to bring is your own dependability there. And yes, it takes time. And you might lose a case here and there, and you're not going to win them all. But never, ever, ever dog the competition. Ever. Never, ever. You're going to want to, because sometimes you have representation that just isn't as high integrity as you'd like them to be, and that's unfortunate. Don't ever say that. Even if you know it, take the high road. You're there to do your job, and that will settle itself. So competition, bring it. I love it. I'll sit in the room with any competition. I'll even cheer them on, because ultimately we're all there to serve the patient. We're all there to help that doctor do what they do best even better. So always take the high road. This is the one, like, if we're going to go sell basketballs or something, man, I'll talk trash about Wilson if I'm selling Spalding. That doesn't matter. But when it comes to this world we're in right now, you never sacrifice your integrity. So, but competition, bring it.
So, a real quick, yeah, no, I want to, so I was just going to expand upon, so I've actually found that you can bash your competition as long as you also like praise them in the same sentence. I mean, just from my own personal experience.
Bless your heart syndrome.
So yes,
When I say praise, like you have to mean it, you have to like know what pros and cons,
there is a bless your heart syndrome, but there
Yeah.
is, it's all about your integrity. And
Yeah.
when you are seen as the girl that bashes everyone, it doesn't play well for you,
Yeah.
because eventually you're going to need to work for that other company, or I mean, it's a small world,
Yeah.
and word gets around, so it's your reputation that you're inflicting,
Interesting.
the damage and scars to. The other thing that I would also like to say about sales, yes, it is competitive, but you have to have a really thick skin. It takes a little bit of time and some scars to build that. But there's a really good book about how many no's do I have to have to get to a yes. So it's really, you can listen to an audio book if you're on a long run, it's not too long. But thick skin, it's a requirement for everything that you do.
Oh, yeah. I ditto what you say. I've become close friends with some of my competitors over the years. And surprise, surprise, sometimes they're combined in therapies and are being sold together after a while. So I agree. Integrity is everything. And that's just in life. And so do the right thing. There are enough, there's a lot of drugs out there, but there are a lot in trial, and there are unfortunately a lot of patients out there that are going to need along their timeline a lot of the different drugs in that disease state. And so have patience with it. Work with your customer. And sometimes there's many times with toxicity that I've had to tell my healthcare providers that their patient doesn't qualify for my drug. And that's the right thing to do. So you learn as you go along. And again, there are great mentorships out there for all this, and it's wonderful. I do want to give a shout out to my sons who are UGA Athens, and they're wearing Clemson shirts today. Yay!
Hey, real quick. So, storytelling is a big theme, obviously, throughout this discussion. So, okay. So, before all this stuff I'm doing, which none of y'all know who I am, but I used to be a filmmaker, and I always found that the best stories. So while everyone was talking about storytelling, I wrote this down, that the best stories are telling your why through being honest, vulnerable, and with a heart of gold, and with a splash of anger. Because I always felt like, me personally, like if I'm too nice, people don't really trust me. But the second I kind of like get a little passion and like, I won't say anger, but I find out that then people go, oh yeah, I like you. Have you guys seen that? I don't know. Is that?
Yeah, I love it. I mean, me personally, I loved every piece of that until the word anger. I'd substitute with
There's probably a better word.
confidence.
Okay, all right.
I'll look you right in the eye and tell you what this product does. I'll look you right in the eye
Right.
and correct whatever you just heard about
Right.
whatever was said. But I'm going to look you right in the eye, and I'm going to be very confident in who I am and what I bring. Confidence can bring some passion to things.
I was just
I'm
about to
not
say
gonna-
passion. Yeah,
It gets you would
it's a
think
podcast.
the OR the OR gets it's just real quiet environment. No, it's pretty active, and there's a lot of language being used in there. Sometimes it gets pretty tense, right? And things are said, and people come right up to you, like, I have nurses come, well, so and so said that your thing does this, and you did this, and I'll just look right. I mean, just right. I will not back down. I'm not going to talk trash about that person. I'm not going to, I'll just address the situation, be matter of fact, and say, can we keep moving on? And then I might just laugh and say, man, they have a lot to say about me. This is crazy. And then what matters though, to this point is, what do you want the conversation to be when you leave the room?
Yeah.
So when you leave the doctor's office, you leave the operating room, the one thing y'all got to know, there's a lot of gossip. So when you leave the room, do you want them to say, man, I love her. You can have her anytime in this OR. This is great. She's so helpful. She knows her stuff. This is great. Or when they leave, they go, oh God, do you have to bring, like, I do not want him in here anymore. He's such a jerk. Like, that is what matters. So I loved everything except for the word anger. Now I get angry.
Confidence, passion, and
Confidence.
being matter of fact. Then is a better way.
Yeah.
All right, that's cool.
Because the OR is a matter of fact. It's like if they're about to drill a 3.5 millimeter hole in a bone, they're going to look over and say, hey, is this right? It's humbling because you're like,
Yeah.
it better be. But to that point though,
Yeah.
you have to be matter of fact. And if you don't know, I don't know, but give me 30 seconds, I'll find out. You don't make it up. You don't guess. It is matter of fact. It's humbling. Again, it goes back to that, but I agree. I'm angry, but I'm
Yeah.
going to be confident in my delivery.
All right. Well, and last thing. So that was like, you just kind of changed my life there. But that quote about being playground work being, what was that quote again? I really liked it.
God made work so adults can play together.
Oh yeah, yeah, yeah. That's like changed my life, man. Thank you.
Just one more thing. In you're starting out, you might be surprised who the gatekeeper is with the clinic. So you want to be nice to everybody from the front desk to the janitor to anybody. And that's just in life, right? You want to be kind to everybody and you might be surprised who that gatekeeper is. So, but it's fun. So I would just say have fun with it. If you're passionate about something, go out there and have fun with it. It can be so exciting. You'll meet some of your closest friends through it, whether it's the people you call on, but also that fair balance in with life. We work so hard. Well, I've worked so hard, and it's for my family, right? So you want to be able to spend time with your family. So make sure you carve out that time to have fair balance in that too.
I just wanted to add to that. I mean, and that holds true in, you know, raising money, or because let me tell you, investors, they have money, whether you do this deal or you come back to them in a few years with the next one. And they're going to remember when you danced around something or when you tried to skirt around something. So anyone in your business classes, if you're in a sales lesson and they're trying to, and they say anyone tries to teach you to take someone down the path of yes, I want you to call me and I want to come in there and yell at them. Get to know as fast as possible. Get to know, because then you know exactly where you are in that conversation. It's not no, never. It's just not right now. And you're going to give me what I need to work on for the next conversation or for that next opportunity. And it's gives you the time. The value of everything in this world now is time. So if I'm going to waste 6 months of a team or just my time traveling, and I'm never going to get there, which, I mean, I'm a kid from New Jersey. I came down and I learned the bless your heart syndrome the hard way. You get competitive, like I'm gonna go back there. I want to go back. It's not going to happen. And if it's a no, I need to move on to something else. I need to go to the next one. I'll keep coming back, but the devotion of time, but the integrity at the moment, where if you don't have a good answer for it, that's when you acknowledge it. You know what, this is this is one of the conversations that we need to talk through. And it may not be what you're looking for, but this is where we're at. But then there might be opportunities to work together to solve it together. That may not be a deal breaker. They may be asking you that question because they might have a resource to help. So acknowledge no, embrace it, because if you're going to be in sales, you better get used to it. But embrace the no, get there as fast as you can.
No, I'm good. I was going to say thank you.
Thank you all. Do you have anything?
Thank you. No, thank you for coming.